Good day, I'm Meljity Bukoboy, student nurse from Nabaysia University of Science and Technology, BSN 3C. And for today's video, I'm going to do a nasogastric tube feeding. For the assessment, first, doctor's order, client's level of consciousness and level of knowledge and understanding, availability and functionality of the needed materials, for any clinical signs of malnutrition or dehydration, for allergies or any food in the feeding. If the client is lactose intolerant, check for the tube feeding formula. Notify the primary care providers if any incompatibilities exist. For the planning, before commencing a tube feeding, determine the type, amount, and frequency of the feedings and tolerance of the previous feedings. And then prepare the equipment. Correct type and amount of feeding solution, 60 ml catheter tip syringe, emesis basin, clean gloves, pH test strip or meter, large syringe or calibrated plastic feeding bag with label and tubing that can be attached to the feeding tube with the drip chamber, tubing, and flow regulator clamp. And then measure container from which to pour the feeding if using open system. And then water, 60 ml unless otherwise specified at room temperature, and feeding pump as required. And then for the implementation, prior to performing the feeding, introduce yourself and verify the client's identity using the agency protocols, and then explain to the client what they're going to do, why it is necessary, and how he or she can participate. Then inform the client that the feeding should not cause any discomfort, but cause a feeling of fullness. So, good day, ma'am. I'm Meljity Bukobo, your nurse for today. Can I know your name and birthday, ma'am? Okay, ma'am. Can I check your wristband for verification? Okay, ma'am. And then for today's procedure, ma'am, I'm going to do a nasogastric tube feeding. So, you need to cooperate with this kind of procedure because it helps you to promote adequate nutrition while having underlying conditions. And also, ma'am, this procedure should not feel discomfort, but you will feel fullness. Is that okay with you, ma'am? Thank you, ma'am. And then next, perform hand hygiene and observe appropriate infection control procedures. Provide for the client's privacy for this procedure if the client desires it, because tube feeding are embarrassing to some people. And the next, assess tube placement. Apply clean gloves. After gloving, attach the syringe to the open end of the tube and aspirate. Check the pH. So, attach the syringe, and then aspirate. Then we need to check the pH. pH level. And then, allow 1 hour to elapse before testing the pH if the client has received a medication. Use a pH meter rather than pH paper if the client is receiving a continuous feeding. Follow agency policy if the pH is equal to the greater than 6. Next, assess the residual feeding contents. If the tube is placed in the stomach, aspirate all contents and measure the amount before administering the feeding. And then administer the feeding. Before administering the feeding, check the expiration date of the feeding. So, warm the feeding to the room temperature. The rationale for this, an excessive cold feeding may cause abdominal cramps. Let's warm it to the room temperature. And then after warming in the room temperature, administer the feeding. And then pour the feeding. Next, clamp the feeding tube. Clamp the feeding tube before all the water is instilled. And then the rationale for this is clamping prevent air from entering the tube. Next is ensure client's comfort and safety. Secure the tubing to the client's gown. The rationale for this is this minimize pulling of the tube, thus preventing discomfort and dislodgement. Ask the client to remain sitting upright in Fowler's position or in a slightly elevated right lateral position for at least 30 minutes. The rationale for this is this position facilitates digestion and movement of the feeding from the stomach along the alimentary tract and prevent the potential aspiration of the feeding into the lungs. So, ma'am, can you please stay in that kind of position? Okay, ma'am, thank you. Next, evaluate the patient's response to the procedure and document the procedure and other important data on the client's chart.